I'm Vanessa Mishanya. We are in a youth mental health crisis right now because of the pandemic. I mean, just look at the numbers that the CDC recently released. They said of the amount of high schoolers they surveyed, more than half said they felt hopeless. These kids have the weight of the world on their shoulders right now. And on top of this, experts tell me that we're facing another crisis, and that's the lack of mental health workers and school counselors to help these students get through this tough time.
Pre-pandemic, there were mental health issues. Since the pandemic, there has been an increase in depression and anxiety, deaths by suicide. I'll be very honest, I did not, even as a mental health professional, I would not have envisioned we are where we are right now.
Lisa Dansby Williams loves her job, connecting students in need with mental health help, but seeing what students are going through right now has been heart-wrenching.
It's just been hard for many of the students and their families to navigate some of the resulting issues of the pandemic, whether that be domestic violence, homelessness, maybe families, mom, dad lost a job.
With all this need, the limited services available that Lisa can find for these kids are stretched paper thin.
We do have a limited pool of mental health professionals to employ. Some have been burnt out themselves by the pandemic.
The national recommendation for school counselors is 1 for every 250 students. According to the National Association of School Counselors, only 17.8% of school districts met that requirement, and only 4.2% of urban school districts met it, according to pre-pandemic numbers.
Now we are definitely seeing an increase in the number of students, families and staff, and even administrators that are referring students and families to us.
Alma Lopez is a school counselor in a California middle school.
It's been a challenge. You know, we're putting in some full days and then some. And so definitely the need to have more mental health professionals in the school building is an essential need right now.
What's been helping, she says, is the waning stigma around mental health and the increased awareness of the issues from lawmakers.
You know, on the national level, our leaders, they're working really hard to be creative with the funding that's being provided to schools across this country. They're really understanding that we've got to put the money and the resources, the attention in mental health.
But she believes more needs to be done, including help for counselors themselves.
People need to actually understand the role of the school counselor and of mental health professionals, right, in the school building.
Making sure that resources are available to them, support from administration, and then also making sure that they take care of themselves.
For mental health workers like Alma and Lisa, no matter what assistance may or may not come, they're going to show up for these students and be their much-needed rock, even if everything is so uncertain.
Right now, there's a greater need to help families, so if I can make it happen, that's what I try to do.
I'm Vanessa Mishanya reporting.
We're digging into the factors that could be contributing to a surge in preterm births among Black women when the race continues.